Bismillahirrahmanirrahim. Assalamu alaikum warahmatullahi wabarakatuh. We are discussing enchondromas. Lytic lesion in the phalanges is most commonly an enchondroma. This is the only location in the skeleton where an enchondroma does not contain calcified chondroid matrix. These most often presents with pathological fractures. Here we have well-defined lytic lesion in proximal portion of middle phalanx of index finger. This is enchondroma. However, we will have differential of bone cyst versus GCT because it is subarticular in location. Here we have seen this is calcified lesion in medullary cavity of lower third of shaft of the femur. Here we see stippled punctate calcification is noted, which is typical of chondroid matrix. So this is an example of intramedullary enchondroma. Here we can see there are low density areas having geographic margins, and in peripheral areas of these low density geographic areas there is supiginous calcification, and this is noted in both medullary cavities of lower third of shaft of the femurs. This is a typical example of bone infarct. So the differential between bone infarct and enchondromas can be sometimes very difficult. On plain films, as in this example, we are unable to see central chondroid or punctate calcification. Here we can see multiple expansile lytic areas are noted in phalanges and metacarpal bones, suggesting multiple enchondromas, and these multiple enchondromas are called Ollier's disease. This is Maffucci Syndrome, where we see multiple enchondromas associated with phleboliths and soft tissue masses in and around phalanges. This combination of the findings invariably represents hemangiomas and enchondromas, which are noted in Maffucci Syndrome. Multiple expansile lytic areas are noted in phalanges, surrounded by soft tissue masses and scattered areas of tiny calcific foci suggesting phleboliths. So these surrounding soft tissue density areas represents hemangiomas containing phlebolith, and lytic lesions in the bones represents enchondromas. Ollier's disease and Maffucci syndromes, multiple enchondromas occurs on occasion. This condition has been termed Ollier's disease. It is not hereditary disease and does not have increased rate of malignant degeneration. The presence of multiple enchondromas associated with soft tissue hemangiomas is known as Maffucci syndrome. This syndrome also is not hereditary. However, it does have an increased incidence of malignant degeneration in the enchondromas. Discrimination, we see that usually matrix of the enchondromas contain chondroid calcification except in the phalanges, and usually there is no periosteoitis or periosteal reaction or pain. Thank you very much. Assalamu alaikum warahmatullahi wabarakatuh.